I'm deeply honored to join you all this afternoon, not only to officially close this symposium on primary health care, but more importantly, to be in time to listen to the summary of the deliberations over these past 2 days. Quite interesting. Thank you for all the hard work. In opening the symposium yesterday, the Honourable Minister aptly described Fiji's current health status. You were informed that non-communicable diseases contribute to about 80% of deaths of persons under the age of 70, and that, among other things, Fiji is the second highest nation with NCD-related deaths in this region. Alarming, quite worrying. You all know that this high rate of NCD-related deaths are caused by our people's own lifestyle choices. You'll all agree that this is certainly not the situation we want our nation to be in for long, especially for many of our people to be dying needlessly simply because of poor lifestyle choices. This is certainly not the Fiji we want our children, and certainly not our grandchildren, to grow up into. You're all aware that Fiji is placing exceptional emphasis on educating and empowering our people. We now have compulsory and free education at the primary school level. We have free education at secondary school level. And we now have great access to tertiary level education, including technical and academic studies, and a clearly focused scholarship system. This is in line with government's overall aim of establishing our beloved nation as a knowledge-based society. Our socio-economic development is improving each year, as exemplified by the consistent positive economic growth over the past 7 years. For the immediate period, government projects that this positive growth will continue over the next 3 years, giving us a record of 10 years of positive economic growth. This consistent positive economic growth is enabling government to improve our national infrastructure, improve our education, and certainly our health systems, in addition to opening up more opportunities for development at the individual and national levels. Within the international community, Fiji has set an unprecedented feat in taking on leadership roles, including chairing the group of 77 plus China, with over 130 member countries, presiding over the 71st session of the United Nations General Assembly, co-hosting the United Nations Oceans Conference, which is going to be held in New York next month, and presiding over COP23 to help address climate change and how it is reshaping the lives of the whole of the Pacific, including Fiji, and most of the world, of the vulnerable people in low-lying communities around the world. Amidst all of these efforts and achievements, it would be a pity to still have many of our people dying young, at the peak of their productivity, from NCDs. Our National Advisor on NCDs, Dr. Isimeli Tukana, has always said that NCDs are not genetically inherited. They are the result of poor lifestyle choices. In the Itoke language, they are referred to as mati suret. In the Hindustani, they are known as Gaya Sankrama Rog. I'm sorry if I pronounced it wrongly, but I'm just reading from the script I was given. The minister's laughing because Hindi is certainly better than mine, but forgive me if I mispronounce that. NCDs are a scourge that is greatly affecting the health and social well-being of our people, our societies, and our nation. Given its potential to complicate lives within a family and community, NCDs can be serious impediments to greater national productivity and prosperity. So, I'm here this afternoon not only in my capacity as the President and Head of State, but also in my additional capacity as Fiji's lead advocate and champion in our fight, a national campaign to eliminate NCDs, to personally lend you my support. Be assured, Minister, ladies and gentlemen, of my total support. I'm very encouraged that in the past 2 days, you have honed in on improving our people's lifestyles, behaviors in 7 specific settings, which include positive thinking, avoiding tobacco, glue sniffing, and marijuana, eating more fresh, locally grown foods and vegetables, drinking lots of fresh water, fruit juices, and responsible drinking of alcohol and cover. It's a worry. exercising every day for at least 30 minutes, having adequate sleep or rest, and having a good family life. I wish to re-emphasize the importance of your role in transforming our nation. You are the frontline health professionals and healthcare providers. Both you and I need to walk the talk and lead by example. We must work together to win the battle against NCDs. We all need to advocate for wellness lifestyles in our respective communities, settlements, and municipalities, through schools and faith-based organizations, in our workplaces, and in sports and social functions. We must aim to change the behavior of our people to lead healthy lifestyles. It is also encouraging to note that our efforts to date have begun to show some favorable and positive outcomes. Recent statistics show that the rate of tobacco consumption in adults has decreased, albeit slightly, from 17.5% to 16.6%. The diabetes rate among Fijian adults has also decreased from 16.5% to about 15.6%. These are encouraging signs and developments. However, high blood pressure in adults has increased from 24.2% to about 31%. There is also an increase of 2% in childhood obesity, compared to an increase of 8.5% in adult obesity. These increases mean that we must continue in earnest in empowering all Fijians to improve and control our health through living a wellness lifestyle. We need to scale up our efforts to change lifestyles in our communities. We need to encourage our people to eat fresh and locally grown foods to reduce their tobacco consumption and control their alcohol and coffee intake. We also need to encourage them to check their health status regularly for early detection and treatment of NCDs. Our challenge is firstly to be good role models before we reach out to all the people whom we are to serve and to promote partnership and ownership of our natural wellness program. I hope that the presentations and real-life stories you have shared over the past 2 days will encourage you to do more when you return to your respective stations. I also look forward to meeting you all when I make my rounds of visits to the schools and communities that each serves, so that we can continue to make positive progress in combating NCDs. I now take great pleasure in officially closing the 2-day symposium. May God bless you all. May God bless our beloved nation Fiji. And for our visitors from overseas, enjoy your short stay and may you have a safe trip home. Nawalyabu, Sukriya, Dhanavad, share, Fayaksha, and thank you all.
Thank you, Bunwai. Your Excellency, willingness to come and mingle with your primary healthcare workers and go through the posters this afternoon. I don't have the word and permanent secretary for health. Your presence in the 2 days, the official opening, to carry out this symposium, and I'm sure we'll get continued Pacific community and also JICA this afternoon. But most appreciative of you participants for coming in the 2 days. Sorry yesterday we feel. Thank you, Honorable Minister and your team. Thank you, GMU. Thank you, WHO. Thank you. You might be able to reach your station safely today and tomorrow. Take precautions on your way back home. May I invite us all to show our appreciation.
I'm a member of JICA in Chicago. Konnichiwa.
Japanese, I know.
Don't do it from the restaurant.
Last year that I started working there as a public health nurse, what I've noticed while doing screening is the number of people falling under overweight.
Happy.